Well, thanks very much for joining us. Today we've had a very successful National Cabinet meeting, the first of which I've had the great honour and privilege to chair. It was conducted in a very good spirit, a spirit of engagement, one that recognised our common interests and our common purpose to serve people in our respective state and territories, but from my perspective, to serve people around the nation. There was a focus, of course, on the response to the health pandemic, which we know is ongoing. And in recognition of the pressure that health and hospitals continue to be under, the Commonwealth has agreed to extend the COVID funding arrangements until the 30th of December this year. There are some arrangements in place as well about some of the measures not being continued beyond September because it was agreed that they were not necessary. Importantly, we've agreed as well that the first secretaries, led by Glyn Davis, the head of Department of Prime Minister and Cabinet, will conduct a process of review of health funding and health arrangements, looking at health reform. What that's about isn't necessarily additional dollars. What it's about is a recognition that our hospital system at the moment has people who should be in being looked after by their local GP, but GPs just aren't available. That the lack of nurses and health professionals in the aged care system means that many people who should be either being looked after at home or looked after as aged care residents end up in the hospital system as well, putting further pressure on the system. And it's recognised as well that a number of the measures that we put in place during our election commitments, including our urgent care clinics that are aimed at taking pressure off emergency departments of hospitals, that will cooperate, including in locations of where they are in states and territories around the nation. I saw this as a very positive measure going forward and as a priority for all of our governments. The second issue that we dealt with today was the issue of skills shortages. It's recognised that we need to train Australians for the needs of today, but also the jobs of tomorrow. And we need to work on a national skills plan in order to deliver that. But it's also recognised that short-term shortages mean that we need to, one, work on clearing the backlog that's there from people who have visas that have been granted and they're waiting 12 or 18 months before they're actually able to take their place in workplaces around the country. That's placing pressure in construction, in infrastructure. It's leading to increased costs. It's also putting pressure on service delivery, and that short-term migration will need to be a part of the solution to skills shortages, and we'll work with the business community as well as working through cooperatively to address those issues. The Council on Federal Financial Relations, which is chaired by the Federal Treasurer, Dr. Chalmers, will also provide advice for the next meeting on pressures on the Commonwealth and state and territory budgets, including the anticipated fiscal pressures with a focus on areas of joint funding responsibility. The Commonwealth is prioritising productivity reform and microeconomic reform, and that was well received by the states and territories. It's something that's dropped off the agenda in recent times. And as part of that will be a review of the former COAG processes that used to exist that were replaced by the National Cabinet. As a result of the National Cabinet being formed during COVID as a response to the pandemic, some of the COAG processes that were really worthwhile to drive that productivity reform, to drive efficiency, to remove duplication, a lot of that's just dropped off. So what we'll have for the next meeting as well is First Secretaries providing advice on the role of ministerial councils in progressing national priorities, but with a particular focus on how do we improve productivity, how do we get those gains through. Can I say as well that the states and territories expressed their support for the Commonwealth's commitment to progress a referendum for a constitutionally enshrined voice to Parliament. As one of my colleagues here said, if not now, when? And we're very concerned that 5 years after the Uluru Statement from the Heart, this reform will just drop off. It is something that's got to be progressed this year, and it's this term, and that is why the support of the states and territories, of course, constitutional change requires 4 out of every 6 states, 4 out of the 6 states with a majority across the country in order to be improved. And that will be an important reform and an important moment for the nation moving forward. We had reports from Dr. Stephen Kennedy, the Head of Treasury, on the state of the economy, and also senior national security officials also provided appropriate briefings to the National Cabinet. The National Cabinet also noted further challenges that the nation faces, including the challenge that's there from energy markets, which are well known at the moment. I note on that the support of the National Cabinet to the shared commitment to our revised nationally determined contribution that we signed yesterday with the support of the Business Council, the Australian Industry Group, the National Farmers Federation, the Australian Chamber of Commerce and Industry, the ACTU, the Australian Conservation Foundation, across the board, and now the support as well of states and territories. And tonight I will be the 5th speaker at the Advanced Economies Forum being convened by President Biden, where we will be further announcing our program of the new commitment that we've submitted to the UNFCCC. Disaster recovery funding arrangements, we need to make sure that they're consistent, streamlined and equitable, and Murray Watt will lead the work on that. The National Cabinet agreed as well that we will invite a representative of local government to a future meeting of the National Cabinet and the Treasury body once a year to each of those meetings to ensure that all levels of government are able to be involved. The National Cabinet has agreed to meet a minimum of 4 times a year or as necessary. We'll meet prior to the federal budget, which will be handed down in October 2022. Can I just thank the Premiers and Chief Ministers on their constructive contribution. I've known most of these people for quite a while. I got to meet the Premier of Tasmania for the first time last night. Everyone came to this meeting with a great spirit of cooperation, with a determination to put the national interest first while representing appropriately their state and territory interests. And myself and the Premiers and Chief Ministers are happy to take a few questions.
Prime Minister, last year when you had a Freedom of Information request for National Cabinet documents blocked, you said it was an extraordinary decision and Scott Morrison was obsessed with secrecy. Did you suggest ending National Cabinet secrecy today? And if not, what changed?
No.
What changed?
You've got to ask one question.
Prime
That's
Minister.
the way they'll work.
Prime Minister.
Just on the cost of living pressures, your government has committed, and Labor did commit, to cut household energy bills and business energy bills by $275, obviously in a time frame by 2025. Is that still possible, or is that out the window? And on that microeconomic reform agenda, what are those keys to unlocking productivity that you're discussing there? What's the time frame in that agenda?
Yeah. Well, on the first question, obviously we are dealing with a a circumstance which is a direct result of a failure to give business the certainty that they needed to invest. So we have problems with the national energy grid as well that isn't capable of having transmission that is fit for purpose for the 21st century. Our plan of powering the nation is supported by the business community because they understand that it is certainty that they require to invest. Can I say that the states and territories across the board, across the political spectrum, have understood this and have been investing, including in whether it's the renewable energy zones that have occurred in New South Wales, in places like the Hunter Valley and New England, whether it be South Australia's lead over a long period of time, the work that's taking place across the states and territories. The WA government have made significant announcements just this week. So we're very confident that as we move forward, that certainty will enable much better outcomes. And that's why business has endorsed our plan. And we'd say to those people who I read today are suggesting that they're opposed to that plan, people want to end the climate wars. They want to move on and to make sure that we get better outcomes going forward.
Prime Minister, can we get the state's views on the...
First to Premier Malinowskis, if I could. You overnight were listed, you became the first Australian Premier or Chief Minister to be sanctioned by Russia. What's your response to that? And Prime Minister, Ukrainian President Zelensky has asked to meet you when you're over in Europe later this month. Will you consider going to Kiev to meet him?
Well, I'm very grateful for the fact that Vladimir Putin has paid attention to the leading role that South Australia is playing in trying to stand up for the democratic values that we all collectively as a country hold dear. Very quickly upon coming to government, my government has sought to do a number of things to send a very clear message that the people of South Australia stand firmly with Ukraine, as does every state and territory. And I'm just grateful for the fact that Vladimir Putin took notice. My heritage, Malinowskis, is a Lithuanian last name, and my family knows all too well the human tragedy that can occur in the face of unacceptable Russian aggression, and I'm very proud of the fact that my government's played a leadership role, and I look forward to doing that in the future.
On the visit, I read about that this morning in the paper. I'll take appropriate advice, and obviously there are security issues as well in terms of such a visit. I appreciate the spirit in which it's been offered, and one of the reasons why Australia has been invited to NATO is that Australia's the largest non-NATO contributor to give support to Ukraine in its defence of its national sovereignty against Russia's illegal, immoral invasion, and will continue to stand with the people of Ukraine. Andrew?
PM, could we just get the state premiers and the chief minister's perspectives on the extension of the COVID funding, whether, for example, it's sufficient for you, Mr Perrottet, given I think you were asking for 12 months, and then also to the South Australian Premier. I think you've got concerns about the proximity to GP services, to hospitals, that you can't encourage people quickly to look elsewhere for services if there's a long wait inside the hospital. But please jump in.
Well, firstly, I think it's a great start. I mean, this is something that we've been discussing at National Cabinet for some time, so to have the first meeting today and for this matter to be resolved to some degree to be extended to December, I think is incredibly welcome and was supported by every state premier and chief minister. But also I think in addition to that today, what's incredibly pleasing is a real focus of working with the states and territories in relation to substantive health reform going forward. We haven't, this is something that's been the too hard basket for too long. We certainly got a sense today from the Prime Minister that we'd come back to a National Cabinet before the budget. That's reassuring in the sense of there are quick areas where we can provide further support for our health systems right across the country that are all going through a challenging time, not just through COVID, but obviously the impacts of that going forward. And the the lack of integration between the GP network and primary care and the public health system is a challenge that every jurisdiction is facing. And working closely with the Commonwealth Government, I think there's great opportunity for substantive reform in that space. As the Prime Minister has said, this is not about money. It's about working together on substantial reform. And I thought today's National Cabinet was refreshingly collaborative.
Thank you. Phil? Well, if they want to, but...
Well, please jump in, Premiers and Chief Ministers.
Andrew. I'm in charge. So if anyone wants to add anything, Anastasia?
Just to add, it's a refreshing change to be able to discuss health. Previously, we had tried to get this on the agenda. We've got a Prime Minister who listens and understands that health is a big issue and it's a national issue that's affecting everybody across our nation. So we absolutely are united in this, and we welcome the extra funding today and also the announcements that the Prime Minister made during the election campaign.
Phil?
Prime Minister, could I just on energy and energy discussions, with the extra demand for gas at the moment as a fix, Premier Andrews, I just wonder, is it too late in your view? You've been criticised by some quarters in recent days about the lack of exploration in Victoria, or the moratorium and how it's put behind. Do you see it as conceivable that onshore conventional gas will ever be extracted in Victoria, or is it too late for that? And to you, Premier Perrottet, Narrabri, could you ever see that gas field being developed or by Santos? Is there anything your government can do to fast-track that, or do you have a desire not to allow that to happen?
Phil, Dan?
Phil, I'd say that there are processes to be gone through, and if gas is found and if there's someone comes forward with a proposal, then there's nothing ruling that out. So no, but we don't apologise for doing exactly what we said we would do. We sought a mandate. We don't have fracking in our state. We're very, very proud of that. If I'm to be criticised for delivering on the election commitments I took to the people of our great state, well then, fine. That's a really important thing for me and my team. Can I just very quickly, on the other issue, which really is the issue of the day, on behalf of every nurse, every AMBO, every doctor, every patient in Victorian public hospitals, I want to thank the Prime Minister. Politics was put aside at this meeting, and we've put patients first, and that's the most important thing. Now the test for all of us will be to work hard in the weeks and months to come up with practical ways in which we can make the system work as a true system. GP primary care, as well as hospitals, NDIS clients, aged care residents. I think we can do that in really practical terms. This was a meeting of goodwill and a meeting where we have put patients first, and there's perhaps nothing more important than that.
Thanks, Daniel. Dom?
Yeah, Phil, just quickly, we're completely committed to Narrabri and working with Santos to get that project off the ground. And a key component of that agreement and the work we have committed with Santos has been that there be a reservation policy attached to that project, of which they have supported and agreed to. So we are completely committed to the Narrabri project.
Thanks, James.
Just on health again, if I may. Was there any discussion today in the nuts and bolts of the meeting about rolling out fourth shots of COVID vaccines more widely to the general population, and also to kids aged, I think it's 6 months to 5 years? That's been approved. 2 shots have been approved by the FDA in the US. Did either of those topics get canvassed?
Just that those issues are under consideration by the appropriate bodies.
50 health funding arrangements outside of COVID. Is there a timeframe you'd like to see that implemented, and will there be key targets for what you'd like to see happen in the hospital system across states? And just to the Chief Ministers, did you bring up territory rights, and is there a time frame you'd like to see that implemented?
No and no are the two answers in terms of those issues weren't raised. But, yeah.
Certainly we're confident there's a pathway forward for territory rights.
Territorian counterpart whilst I was here, and we have had those discussions, so at the appropriate time we'll certainly progress them.
And I'm on the record about those issues. Anna?
What's the first concrete step that will now be taken to deal with it, and will you provide more funding to Home Affairs to deal with the backlog? And perhaps the Premiers would like, and Chief Ministers would like to say something too.
I can report, as I did to the Premiers and Chief Ministers, that I've already done that. We have put people from other duties into trying to clear the visa backlog. That clearly is something that's required, is necessary, and is the easiest way to make an immediate difference. Mark? Mark and then...
Prime Minister, a question to all of you. It's material to everybody about whether we're still in a pandemic or are we coming through the pandemic, as the previous Prime Minister said, and almost through it, or is it over? Because it obviously affects your agreement on health funding and so many other things, that declaration. Australia was one of the first countries to declare we're in a pandemic. When do you, as a National Cabinet, foresee Australia being through this pandemic and beyond it?
Well, clearly the decision that we made today to extend the funding is a recognition that there are currently around about 3,000 people in hospital as a result of COVID. It's still having an impact, which is why the Commonwealth felt that it was a reasonable proposition being put forward by the states and territories for increased Commonwealth funding on the basis as well that states and territories will continue with the funding that they had committed in their budgets based upon the cessation of those special arrangements being 30th of September this year. So what that means, if you like, in simple terms, is there's more than 100% of funding going in for this period. The basis of our increase won't be then a withdrawal, because that wouldn't help the circumstances. So that's an example, I think, of the cooperation and goodwill that was around the table last night and around the meeting room this morning. But I'll leave it if colleagues might want to add. No? Okay, just hit. Just
what's your advice on when this pandemic is over?
Sorry,
we'll get advice. It clearly isn't over yet, and it would be very brave to suggest that you can make that projection. You know, Omicron arrived in a way that wasn't foreseen. What governments have a responsibility to do is to respond to what's in front of them, and that is what we've done today.
Thank you very much. The extension of the agreement was important. Less so in terms of what the position is on the pandemic, but there is no doubt every hospital around this country is still facing the impacts of hospital presentations in relation to COVID, but in addition to that, the long-term impacts that we've seen over the last 2 years of COVID on our systems. So there has been a substantial delay in elective surgery and those matters in the public health system that have been put off to support COVID. So it's a combination of those two things, and that's why I think the decision today was certainly welcomed by every state and territory.
We'll just take a couple more because people have planes to get on. So,
just a question for Premier Andrews and yourself. Premier Andrews, about a year ago now, the then Morrison government struck down your MOU, your Belt and Road MOU with the Chinese government. Now there's been a change of government in Canberra. Is that something you'd be looking to revisit? And Prime Minister, if it is revisited, what would be your approach to that?
No, those matters have been settled.
Yep.
People are still catching COVID and being hospitalised due to COVID come December. That funding arrangement will be extended beyond that?
No, it doesn't mean that at all. It means we've come to an agreement today based upon the circumstances which we face in the health system. What it means is that in June, I won't be, you can't answer questions about December. It means we're responding specifically to the circumstances which are there, the pressures on the state and territory health systems, but also I've made very clear that the government has inherited $1 trillion of debt. The idea that we are in a position to continue to offer more funding across a range of issues that are necessary. There are fiscal pressures on the Commonwealth, which people understand. But at the same time, that's why I was very heartened by not only the positive response to our extension of the agreement to December, but also the debate that we had, which wasn't about dollars, as Premier Perrottet said. It was actually about how you get reform, how you get efficiencies, how you make sure that patients are at the centre of the system. Patients. That's what it's about, making sure that Australians get the health care that they need when they require it. Last one, John.
Thanks, Prime Minister. You mentioned the skills shortages and you said short-term migration will need to be part of the solution. Beyond the visa backlog issue that you're sorting out, are you flagging any changes to the migration program there? And Premier McGowan, given the skills shortages in WA, would you like to see anything happen on the more immigration for skilled workers coming into Australia?
Well, we're working on those issues. We're a government that have been in place for a matter of weeks, just weeks. So we are working on those issues with the department appropriately, and I've discussed with the Minister for Home Affairs as well as the Minister for Immigration, as well as Brendan O'Connor, who has the responsibility for skills and training, how we deal with these issues. In the immediate sense, though, straight away, in the week that I became Prime Minister, I directed, before even ministers were appointed to those jobs, I directed the departments to look at the backlog, and indeed the meetings that I had prior to the election, I foreshadowed to departmental heads that was something that we needed to address. In the meeting that I had the day I addressed the National Press Club, I had a range of briefings that we put in place with Prime Minister and Cabinet, the visit to the Quad Leaders meeting, but other things as well. Without being presumptuous, we got departments ready to act. Premier McGowan.
Obviously, it's one of the biggest issues facing Western Australia. As you know, our economy is very, very hot and very, very strong. Very low rates of unemployment, very high participation rates. So attracting more people into the state is very important for the economy, not just of the state, but also of the nation. I appreciate and support what the Prime Minister has done to put more resourcing into dealing with the visa issues, and I think that's a great contribution both to Western Australia and all the other states that are having the same issues. We obviously want to work cooperatively on that, but we also run campaigns in our friendly states in the east to attract people from the east as well to work in industry in Western Australia, basically based upon the fact you can get a very high-paying job and a house which is half the price of a house in Sydney or Melbourne. So there's a lot of appeal to coming and living in Western Australia. And I think I've just wrecked the bipartisanship.
With that ad for the great state of Western Australia, with its 4 new House of Reps members, we'll leave it there.